here in the United States, there are about 475,000 children who sustain a traumatic brain injury. In Virginia, there are roughly somewhere between 400 and 500 children who are hospitalized as a result of traumatic brain injury. There are a number who die, and that number is not in my head right now. But 400, 500 kids, that doesn't include those kids that have a concussion, that go see a pediatrician, that go to the ER, and who are not admitted. So we know that the numbers are much, much higher. Brain injury is the leading cause of death and disability in Americans under the age of 45.
Now,
we've learned an awful lot about what happens when someone sustains a mild brain injury in the last 10 to 15 years as a result of the theater conflicts in Afghanistan and Iraq and soldiers exposed to blast injuries. But certainly what we've learned about concussion. I think many, many years ago we did not understand that a simple bonk on the head that didn't result in a hospitalization and didn't result in a gaping head wound could have long-term effects. And so we've really begun to understand that you don't crack your motherboard and not expect there to be consequences. There are a number of issues that arise after traumatic brain injury. Frequently what we see are individuals who may be significantly impaired in terms of their mobility. But more frequently, we see individuals who have cognitive disability as a result of the brain injury. And the cognitive disability can frequently lead to behavioral issues. Specifically, in terms of cognitive disability, we see individuals who have memory problems. They have problems sequencing and planning activities. They have problems making decisions, and they have problems controlling their impulses. And so these can lead to a number of issues later on, particularly in terms of academic performance and forming social relationships. I think one of the issues that we see most frequently in children is the assumption that children recover more quickly from a brain injury. But when you're 3 and you have a brain injury and you come home and you're able to tie your shoes and feed yourself, that's what a 3-year-old is supposed to do. And so we begin to recognize that issues related to brain injury frequently don't show up in kids for many, many years as they mature naturally. Frequently, again, what happens in kids is they're often misdiagnosed. So they might be given a diagnosis of learning disability or attention deficit disorder. And it's sort of like treating cancer with diabetes drugs if you don't know exactly what the problem is. Children frequently grow into their brain injury. It affects their academic performance for a very long time. They have trouble remembering what classes happen on what days and what books to take and what homework to do. They have problems retaining information that they hear in class, specifically related to instructions on how to complete homework. Certainly as we get older, children begin to find that they have difficulty with less concrete information. They have difficulty thinking in the abstract. So when the manner of instruction changes, when a child hits junior high school and they need to think abstractly, that's a difficulty that they have. And certainly the sequencing and the organizing and the planning, all of the things that add to academic performance can be significantly impaired as a result of brain injury. One of the primary issues they face is that of stamina. They can't pay attention that long, they have trouble concentrating, and we frequently find that we need to limit their exposure to things like television and texting and video games.
Justin Davis dealt with a traumatic head injury at the age of 5, and research have shown that a lot of times the symptoms from the head injury doesn't show up until like that early teens, 12, 13 years old. And this is at about the same time that Justin started using marijuana and went on to use. Justin Davis' traumatic head injury showed up as him not able to focus, having some impulsivity, and not able to concentrate. And when you couple that in an environment where there are peer pressure, where there's peer pressure and you really don't know what might be going on, that it does tend to lead to the use of marijuana, which relaxes you, which takes those stresses away, which causes you to forget the problems. You don't have to focus on that. So a lot of times our youth go towards that, and that's their road to maybe using other drugs that become so traumatic in itself as well, that it would require external support.
Results of brain injury will frequently result in an individual having problems with impulse control and the filter that tells us what's right and socially appropriate behavior. So it's not uncommon that individuals with brain injury might experience drug and alcohol addiction, although it's not necessarily the norm. But when an individual has that tendency, the brain injury certainly makes it difficult, both in terms of treatment and in terms of self-control. Studies that have been done of individuals that are in correctional facilities both show a very high rate of brain injury, because folks tend to make some bad decisions sometimes when they have a brain injury. I think that if an individual is diagnosed appropriately early on and given adequate and appropriate rehabilitation, they learn some cognitive and behavioral strategies that we can counteract the effect of brain injury and give them alternative courses of action that would lead to a less troubled life.
In Justin's case, when this traumatic head injury happened at 5, and he started when he became a teenager at 12, 13, 14, the symptoms or the behaviors that he would display, it kind of mimicked something that may look as a behavioral problem. And if you don't really know where these behaviors are coming from, it's really hard to say, this child had a head injury. This child, we need to look at it differently. We need to look at how we're going to help this child cope, how we're going to help this child use his cognitive functioning better. So it starts mimicking things as a behavioral problem. Then you get the administrative with the school system who's tired, who don't want to deal with it, who don't want to take the time out to figure out what might be the problem, and they kick them out. They put them in alternative schools, whatever whatever their solution is, and then you have this child who spirals and snowball out of control and lead to other things that are not healthy for them. Parents who may have a child that has a traumatic head injury, there is hope that you could get your child help. In Justin Davis' case, I think that just the incident itself has grown an awareness. If you're dealing with one child that has a head injury and there are problems in the school, the recommendation for me is to work closely with the school, have your child tested, see what they can do for your child from these tests. And again, I don't push medication, but medication can help in some cases. It may be that your child needs to take medication, your child needs to have medication and therapy. There may be some behavioral plan in place for your child at school so that they can be successful. People with addictive behaviors, it's really hard to determine who will be addicted to any drug, alcohol, PCP, crack cocaine. But when you do become addicted to a drug, it becomes a brain disease. And I think over a few decades, this has been new research where people now are calling it a brain disease, because it hits so many, the pleasure part of the brain, one, and other parts of the brain where it's damaging the brain. And And in order for you to repair the brain, there has to be some detoxification from this drug. Um, and also in conjunction with therapy, whether it's a mental health or a substance abuse therapist, and sometimes medication is required. Um, when this information is dispelled to clients that I work with that are dealing with addiction, they are really surprised to hear that it is a brain disease. They want to know what's wrong with me. Why can I not stop? And when you explain to them how it affects the brain, what parts of the brain that it affects, then they start to understand that it's not me. It's not me that can't. It's a brain disease. And with education, so like I said before, with medication and with some sort of support, whether it's through the mental health, through substance abuse, or even through the spiritual community, that it's treatable. And there's several different street names for PCP. You got embalming fluid, and people really actually think it's embalming fluid that they get from people who embalm bodies, but it's so numbing. The PCP is so numbing that that's another name for it, embalming fluid. It's founded back in 1950, used for anesthesia for humans, and the veterinarians started using it as well. They disbanded in humans back in the early 1950s. PCP is a drug that you have to take serious. It could be a deadly drug. It could cause harm for the person who's using it and others. There's so many different symptoms that come with using PCP that it's just unreal. And again, it mimics schizophrenia. It has the delusions, the hallucinations, the paranoia, the agitation, the violence that go along with it. There's so many different symptoms when using PCP. And unfortunately, it is gripping our young generation. It is rising, and just doing research, it said one of the Centers of Drug Control Division of Control had said that in 2008 there was an estimated 37,266 emergency department visits on people using PCP. So it continues to rise. That's the further. It didn't give much more data than that. It just gave me back to 2008. So can you imagine just that number, what it looks like now today? So it's really growing rampant in the young generation. It's also used in ecstasy. PCP is also another form of ecstasy. It's called it's the club drug. And that's another reason why young kids are using this drug, because it just goes on hours for hours and hours. You feel the effects in 2 to 3 minutes, but it lasts up to 6 hours. When you go into treatment, whether you see someone, a psychiatrist, a psychologist, a therapist, that you get the stigma that you're crazy, and you're not. And don't ever think that I go see someone to take medication to help me with this problem, this brain disease, which is a vital part. It's a vital organ that we all need to stay healthy, to cope, to deal with day-to-day stressors and to decision making. It's a very important part of an organ that we need to take serious. The heart can be repaired, the lungs can be treated, so can a brain disease such as addiction. It can be treated.
We find that a neuropsychological evaluation that's done by someone who understands brain injury can be very, very helpful. There are certain batteries of tests that will point out the difference between what we may be seeing in their performance. In the case of a child that's had a moderate to severe brain injury, likely they'll be seen in the hospital, but it's critical that the treatment professionals have some knowledge of brain injury. Don't go to find a neurologist. What you're going to need is a pediatric physical medicine and rehabilitation doctor that specializes in brain injury, as well as other professionals who understand kids and brain injury. For those individuals that have a mild brain injury, parents need to pay attention. Complaints about sensitivity to light and noise and headache and nausea, all of these things that might be attributable to something else, but if you know the child's had a fall or been playing football or soccer, those things need to be investigated and appropriately identified. Certainly individuals can contact the Brain Injury Association of Virginia at biav.net, or they can contact the Brain Injury Association of America if they're watching this in the larger scheme. Their website is biausa.org. There are professionals who are certified brain injury specialists that can give you customized, individual information specifically for your situation and point you in the direction that you need to go. So many of the brain injuries that occur every year in the United States fall into the mild category. And for individuals, including kids, that are diagnosed and treated early, the chances of recovery are very, very good, and there won't be long-term effects from the brain injury. But it's critical that you understand that these things cannot be taken lightly. They need to be respected. The brain is everything to us, and we need to take good care of it. So it's better to be safe than sorry later on down the road. And your safety and your vigilance at the outset for a better outcome for those you love. The stigma that's attached to brain injury has always befuddled me. So many times individuals are afraid that it's going to mean that they're less than they are if they're given a diagnosis of brain injury. And I know for a fact that there have been parents whose children have had a brain injury who believe that if you just gut your way through it, and you don't have any accommodations at school, that it's going to make you stronger, going to make you recover better. And I don't believe that's the case. We understand that a brain injury is just a facet of a human being. It doesn't lessen their value. It doesn't lessen their worth. It doesn't lessen anything about them. And that given proper care and proper identification, it just becomes part of who they are. And I believe that we've learned an awful lot about how to cure different aspects of brain injury, and we need to be focused on a cure for all of the aspects of brain injury, whether that's surgical intervention at the outset or better use of drugs or better and more effective therapies. We're learning an awful lot about how to do that, and it's the next great frontier because the brain's everything.
With some helpful tips and resources that when you have a child that's have a traumatic head injury and who had turned to drugs for their coping mechanism, there is resources. You got your local community service board who should have a mental health department, have a substance abuse department. You have the schools who should have a psychologist on site that should be able to do testing. There's a children unit in the community service board as well. If you want to pay private, you can go that way with insurance if you have that, to seek out a psychologist who do testing to figure out what's going on with your child. There is support. There is hope. It's a new day. And for the parents, get support for yourself as well. There are groups that or support groups that have parents who are going through the same issue, and you could be a support to one another. You can hold each other up because this is a serious problem. It's a long road.